21,092 have now died. That's an increase of 360 fatalities. And we must never lose sight of the human cost of coronavirus and the pain and the grief that it causes. And each death serves as a reminder that we must stand firm in our resolve. Sadly, these death figures include 82 NHS colleagues and 16 colleagues who work in social care. They dedicated their lives to caring for others. And I feel a deep personal sense of duty that we must care for their loved ones. Today, I'm able to announce that the government is setting up a life assurance scheme for NHS and social care frontline colleagues. Families of staff who die from coronavirus in the course of their essential frontline work will receive a £60,000 payment. And as a government, we're looking closely at other professions that work on the front line against coronavirus who also do not have access to such schemes to see where this may be required. This crisis has shown this country values so much our health and social care workers. And I want to pay tribute to the perseverance of who, even this warm spring weekend, in their vast majority, did the right thing and stayed at home to protect the NHS. Thus far in this crisis, at every single hour of every single day, the NHS has always had the capacity to treat the people who need that treatment. I'm glad to be able to report that there are now 3,190 spare critical care beds. Indeed, 42% of oxygen-supported beds in the NHS now lie empty. And in most parts of the country, the number of people in hospital with coronavirus is beginning to fall. One of the reasons NHS capacity has always exceeded need is because of our amazing programme of NHS Nightingale hospitals. Today, I was proud to attend, virtually, the opening of the 8th of our 10 Nightingale hospitals across the UK, again built in a matter of weeks. This Nightingale Hospital project stands as a monument to the nation's ability to get things done when it matters. This is one of the most ambitious projects this country has ever seen in peacetime. And I'd like to thank the NHS, the armed forces, and all the companies that have worked side by side to make these plans a reality. The Nightingale project is just one of the measures that's boosted capacity all across the NHS. By re-enlisting thousands of former staff, former clinicians, and enrolling early thousands of students, we've boosted the workforce of the NHS. And we've changed forever the digital capability of the NHS. I think many people who've now used online GP consultations and online outpatient visits won't ever go back. And I pay tribute to the staff who've worked in different ways to how they would ever have imagined, and who've been more flexible and open to change when it was really needed. So where there have been advances amongst these huge challenges of this crisis, we must not lose them. However, we also know that fewer people are coming to the NHS when they need to. A&E attendances have dropped to 221,000 emergency department attendances in the last week, compared to 477,000 in the same week last year. That's more than 50%. Now, some of this drop is due to lower road traffic and people following the social distancing rules. Some of it will be due to people accessing the NHS in ways that work better for them, like online or through pharmacies, and that's a good thing. But in some cases, we know that the drop is due to people not coming forward and using the NHS for critical things that matter. Our message is that the NHS is open. Help us to help you. So if you're worried about chest pains, for instance, maybe you might be having a heart attack or a stroke, or you feel a lump and you're worried about cancer, or you're a parent concerned about your child, please come forward and seek help as you always would. It is so important that everybody uses the NHS responsibly, and the NHS will always be there for you when you need it. Just as it's been there for us all throughout this crisis and throughout our lives. And as the number of hospitalizations from coronavirus begins to fall, I can announce that starting tomorrow, we'll begin the restoration of other NHS services, starting with the most urgent, like cancer care and mental health support. The exact pace of the restoration will be determined by local circumstances on the ground, according to local need and according to the amount of coronavirus cases that that hospital is having to deal with. Having written off £13.4 billion worth of historic NHS debt, I want to ensure that the NHS is always for the future. We're coming through this peak. We'll honour those who've dedicated their lives to caring for others. But it will count for nothing if we let things slip now and risk a second peak. I know that lockdown is hard for so many people, but let us all have the resolve to see this through. So please, stay at home, protect the NHS, and save lives. We're now going to go to Professor Chris Whitty, the Chief Medical Officer, for the daily data charts, and then we're going to take questions from the public.
Thank you very much, Secretary of State. So just the first slide is just a reminder to people of the 5 tests for adjusting the lockdown. The first 3 of which are about the epidemic, that the NHS has capacity to provide critical care across the UK, a sustained and consistent fall in the daily deaths overall from coronavirus, and the rate of infection decreased to manageable levels across the board. Then there's an operational point about operational challenges, including testing and PPE in hand with supply able to meet future demand. And then finally, and importantly, confident that the adjustments to current measures will not risk a second peak of infections. Next slide, please. The next 2 slides are really ways of looking at whether people are continuing, as they have been consistently throughout this crisis, to heed the guidance in terms of keeping pressure off the NHS by staying at home unless they have to go out for necessary things. And as you can see, after a very remarkable fall initially, broadly this has been flat, very slight trending up in terms of motor vehicles, but otherwise really the data remain largely unchanged on these transport metrics. Next slide, please. And then looking at other forms, the driving we've talked about before, a very slight increase in walking, public transport remains largely flat. So evidence, I think, that the great majority of people are continuing to honour the lockdown, which is helping us to drive the number of cases down and therefore take pressure off the NHS. Next slide, please. The next few slides are really ones that people who watch these briefings will be very familiar with. It's just the most recent data. So new cases in the UK, as you can see, obviously one thing we have to bear in mind is the number of tests is going up overall, but despite that, the trend is flat or slightly down in terms of positive cases. Next slide, please. But when we actually look at people in hospital, I think the trends that demonstrate that over the country as a whole, we're going through the peak are reasonably clear to see. Obviously, a bigger fall in London, but the rest of the country in different areas either flat or decreasing over time. Next slide, please. And then when we turn to one of the most important questions, which is critical care capacity, if you look at these trends across England, Scotland, Wales and Northern Ireland, these are the percentage of all critical care beds being used for COVID patients. And both in absolute and in relative terms, this is gradually trending down. But importantly, and I talked about this last time I was here, this is a very gradual peak. We're not seeing a dramatic fall off, and nor do we expect to in the next short while. Next slide, please. And finally, sadly, people are continuing to die. As we have said every time just after a weekend, there's an artificial drop because there's less notification over weekends. So the number of cases who sadly were reported as having died yesterday was 360. I do actually expect there will be a bit of an uptick again later in the week as we catch up from the weekend drop. Nevertheless, the trend overall, as you can see from the 7-day rolling average at the top, which smooths out these weekend effects, is a gradual decline, but we are definitely not consistently past the peak across the whole country at this point in time. Finally, a slide which compares different countries, and again I would be really clear that we should not overinterpret the absolute numbers. The way these are actually measured in different countries is different, but the trend lines I think are reasonably clear from this. Thank you very much.